Medicare versus Medicare, Australia versus the US. Welcome back to the show. Today we are putting two healthcare heavyweights head to head, Australia's Medicare versus America's Medicare. Same name, completely different beasts. We'll unpack the similarities, dive into the differences, examine why Australia's Medicare stands up stronger, and then in the final segment, we'll take a hard look at the purported superiority of the US system and the real world failures behind those claims. Let's get into it. First, the similarities between Australia's and US Medicare. Let's start with where they overlap, at least on paper. Well, the name and the ideal. Both systems are called Medicare and were born out of a similar ideal to provide publicly funded healthcare to people who need it most, regardless of wealth or status. 2. Funded by the government. Both are federally funded. In Australia, that's through the Medicare levy, which is a small percentage of taxable income. In the US, it's via a Medicare payroll tax deducted from wages. 3. Coverage of core services. Both systems cover hospital care, doctors' consultations, and essential medical procedures. Whether it's a hip replacement or a diagnostic scan, both Medicare include the basics, though how accessible or affordable they are is another story. 4. Direct billing concepts. Australia uses bulk billing. That's when your doctor bills Medicare directly and you pay not a cent. In the US, a doctor who accepts assignment does something similar, bills Medicare directly, and the patient may avoid out of pocket costs. Again, that's in theory. Oh, yes, the name, the funding model, and the structural skeletons share a few similarities, but that's where the resemblance ends. Key differences between the Australian and the US Medicare. And there are many. 1. Who's covered? Australia's Medicare is universal. Every citizen, every permanent resident, from birth to old age, is covered. In the US, Medicare is not universal. It kicks in at 65 years old or earlier if you have certain disabilities or end stage renal disease. Everyone else? Well, you're on your own, or you'd better have a private insurance or employer coverage, or good luck. 2. Private insurance role. In Australia, private health insurance is supplementary. It gives you faster access to elective surgery or a private room, but it's optional. In the US, private insurance is practically mandatory, even for Medicare users. You often need extra policies like Medigap to cover co-payments or Medicare Advantage plans just to plug the gaping holes in the system. 3. Costs to the patient. Here's where the contrast is brutal. I say it again, brutal. In Australia, if you're bulk billed, you pay nothing. Even when you're not bulk billed, the out-of-pocket cost is often modest. $30 here, $50 there. Maybe it's increasing now. But in the US, retirees on Medicare still pay premiums, deductibles, co-pays, and often thousands of dollars a year out of pocket. For a system meant to protect seniors, it can push them into poverty or bankruptcy, as we said earlier in another episode. 4. Administrative complexity. Australia's system is already complex enough, but it's still considered simple. One card, one payer, done. US Medicare? A maze. You've got parts A, B, C, and D, dozens of private insurers, network rules, pre-authorizations, claims denials, appeals, and billing nightmares. It's bureaucratic chaos masquerading as choice. 5. Medication coverage. Australia has the Pharmaceutical Benefit Scheme (PBS). It negotiates drug prices on behalf of the public, keeping costs affordable. The US has Medicare Part D, which is fragmented, privatized, and astonishingly expensive. There is no central negotiation power until very recently, and even now, only in limited areas. Drug prices in the US are often 10 times higher than in Australia. 3. Why Australia's Medicare is superior. Let's say it plainly. Australia's Medicare delivers more for less. It is true universal access. Rich or poor, rural or urban, you walk into a public hospital or bulk billing clinic, you get treated. No questions about your wallet. 2. Equity and fairness. It redistributes resources. Everyone pays a little, and the system ensures everyone gets what they need, regardless of income. 3. Simplicity and speed. There's no wrestling with multiple insurers, no endless phone trees, no opaque policy fine print. You show your Medicare card and get on with your life. 4. Better outcomes for lower cost. Australia spends about half what the US does per person on healthcare, and yet Australians live longer, have fewer avoidable hospitalizations, and no one goes bankrupt from a hospital visit. 5. Medication affordability. Thanks to the PBS, medications that would cost a fortune in the US are available for a few dollars in Australia. 6. Public trust and system stability. Australians may grumble about wait times, but they trust the system. It's fair, predictable, and relatively transparent. Compare that to fear, confusion, and cynicism many Americans feel about their system. Now, the purported superiority of the US Medicare and its brutal reality check. Now, let's be fair, or at least start that way. Proponents of US Medicare often tout several advantages, but let's examine each one and call out the reality. Claim 1. More choice and innovation. Yes, America is home to cutting-edge medical tech and advanced treatments. You can find world-class specialists and top-tier hospitals. Reality? Unless you're wealthy, good luck accessing any of it. Choice is limited by insurance networks, pre-approvals, and out-of-pocket costs. And innovation doesn't help the average person if it's out of reach financially. Claim 2. Private sector fuels global medical innovation. The argument goes, high prices and profits drive research and development, producing the next generation of miracle cures. The reality? Innovation is built on public funding, then monopolized by private companies. Patients, even seniors on Medicare, are priced out of every drug their taxes helped develop. The system exploits illness for profit. Claim 3. Tailored plans through Medicare Advantage. Medicare Advantage offers customizable plans with dental, vision, gym memberships, and even cashback incentives. Reality? It's a shiny cover for a corporate takeover of public healthcare. Insurers routinely deny or delay care, limit your doctor choices, and milk the government for profits. Many enrollees are trapped in the plans they can't navigate or leave. Claim 4. Better provider compensation means better care. Higher fees mean top doctors, better facilities, and more choice, right? Reality. What it actually means is higher healthcare costs overall. The US overpays for everything, from scans to surgeries, and yet primary care and rural access still fall apart. Money isn't going to where it's most needed, it's going to volume, not value. Claim 5: no waiting lists, total freedom of choice. US Medicare patients are told that they can see anyone anytime, no gatekeepers. The reality: freedom only exists if you can afford it. Many patients skip care because of the cost, even with Medicare. And those no wait promises? Only for the rich. Everyone else waits and suffers in silence. So let's be honest. Australia's Medicare is not perfect. Bulk billing is under strain, hospitals are stretched, and the cracks are showing. But compared to the fragmented, profit-obsessed, and inequitable US Medicare system, it still delivers more access, better value, and greater fairness to everyone. The US doesn't have a healthcare system. It has a healthcare market where profit often comes before patience, and care depends on what kind of card you have flashed at the front desk. Australia, for all its issues, still remembers the point of Medicare: to treat people according to need, not net worth. If you found this episode useful, challenging, or even infuriating, don't keep it to yourself. Share this video podcast, especially with friends in the US who are still stuck in the healthcare echo chamber. Comment below. We want your thoughts, especially if you have experienced both systems yourself. And if you're here new, subscribe. This channel is about clear-eyed, no-nonsense evaluation of systems that affect real lives. No hype, no tribalism, just honest conversation. Let's change the way we talk about healthcare, one episode at a time. Because your healthcare, your health matters.